Welcome once again to the second half of Health, Hygiene and Wellness. We are still continuing our discussion about autism, and in this second half I would like us to get more about how we can prevent autism, what are the treatment for autism, and much more. So welcome back, Daktari. We continue with our discussion. Now, we find that in the past years, maybe in the 80s and in the 70s, we didn't have so much patients of autism. Why is it that all of a sudden autism has just taken over and it's a common disease right now?
Yeah, I know that's a very good question. You know, in the old years, we didn't have proper ways of diagnosing autism. And we could even classify autism with other diseases wrongly. But right now we have enough technology to diagnose autism, because autism is an old disease. Yeah, you know, it is not new. Any chromosomal diseases are old diseases because there's a lot of gene mutation that goes on. So that's one reason we are able to diagnose autism even before the child is born. We can be able to tell you that this child might be born with autism. So we can even do the ultrasound, very specialized ultrasounds that can take and tell you that the child has autism. Number two, also health education. You know, since the inception of internet, the parents want to know every step of the child. You know,
Yes.
if the child didn't walk at 1 year, they want to know why. And if why is it that this child is having this other related signs? And they'll always know. Not like the previous years when you could not even ask, you needed to see a doctor before you could understand if your child has autism. So we also thank Google, because you know, the funny thing about women and mothers and parents, they always want to go to the internet.
They are always a step ahead.
Why is this child drooling saliva every day, and my neighbor's child is not drooling saliva? So by the time they come to you, probably they have a question of autism in their mind. So it is you just to demystify it or to confirm it. Now also our lifestyle, you know, if you look, 2 years ago we did a research on obesity. We were surprised. Almost half of the women who are childbearing age in Kenya are obese. Almost half, you can imagine, who are childbearing. When the woman gives birth to a child, they become obese. They don't go back to the slim ladies they were before they...
And that is a risk factor.
Yeah, they gave birth. And that's a risk factor, because maternal obesity is a very strong risk factor for autism. I'm not saying those women who are obese will give children who are autistic, but you need to work on it, work on your weight, so that at least by the time of conception, you don't get a child who is autistic. And also, you know, life has changed. Do you know that also women take a lot of these drugs, the injectables, the nicotines, they smoke cigarettes, they use tobacco. And by use of tobacco, you know, people usually think tobacco is only used by smoking cigarettes. No, even shisha has tobacco. Even the other things like kerigo, the ones we put in our mouth and whatever, kuber, they are forms of tobacco. And these women are using them. So if you use them, likely there is a risk for autism. Alcohol, this very strong, what do you call them? You know, I forgot about alcohol some years back, but there is this spirits. They have very strong chemicals that cause autism. So if a woman takes alcohol, especially when they are pregnant, the first trimester, there is a risk for autism. Plus some other drugs. There are people who are just taking funny drugs without prescription from a doctor. There are other drugs maybe for beauty reasons and other things. There is things that are causing autism. Then also the genetic predispositions. Our families also, there is a high gene mutations, I don't know why, of late, which is causing autism. So those are the risk factors that are there. And that's why autism has come up a lot.
And why, Daktari, does it only affect their communication or behavior? They can't communicate. Why?
Yeah, you know, it is a disease that affects the brain. It affects the cognitive function. So if you want to know if a child has autism, if you enter a house and call their names, you know, if you call a child, any child by the way, even at 6 months, if you just make a certain sound that is friendly to the child will look at you, isn't it?
Yes,
Even if you are a
they'll
new
tend to
person,
respond, yes.
they'll tend to respond, even if verbally or just physically. But these children who have autism, they take so long to respond. You will maybe call them by the name, then they don't even respond. After some time, that's when they respond. Number two is the eye contact. This child, they don't keep the eye contact so well with the person. You know, children should keep a very close eye contact with you. The mother or even any person who comes in new, you will realize a child will look at this person in the eyes. But those children who have autism, at times you enter the house and they even don't know if you have entered the house. They'll just make a small move, look at you, then go back. They keep on staring to one thing. Most of them will find if they are big, they like the electronics, you know, the radio. They like having earphones in their ears and listening to music. They just like watching TV, but they are not interested a lot in the
environment.
Yeah. So that loss of interest in the environment, even playing with others. Or if they play, they overplay, they can injure others. They are always the children who are in mistakes. They want to break things in the house and other things. So it could be autistic. They are just hyperactive, or sometimes they are just too slow for life. So that is why you will identify that they have autism.
All right.
Yeah.
And let's talk about the preventions. How can we prevent?
Prevention is just what I've talked about. You know, if you are a woman and you intend to raise a good family, you need to live a healthy life. You need to work on your weight. You need to eat natural things like things that come from the farm, you know, and avoid this junk food. It has some chemicals that can cause problems to your genes. Don't smoke. Don't take a lot of alcohol. Don't take drugs, the illicit drugs. Then also, don't take drugs over the counter, which you don't know. The doctor must prescribe your drugs, because if you like taking drugs over the counter, for example, steroids, you know, steroids can always, I've talked about steroids almost in every topic that I've said, and steroids, they can cause all types of diseases that you have in this world. A good example is the prednisone, and I keep on mentioning that drug.
Yes.
You know, this drug can always cause problems. It can even change your immune system function. And you know, if your immune system function changes, it can make your body to become very sick, because it can even injure the genes themselves. So if your immune system does not function well, it can injure the genes. So there is a genetic mutation. By the time you are giving birth to this child, the drugs you used have affected your genes. So the genes that your child is inheriting are not
the affected ones.
Yeah. So live a good life. Eat a balanced diet. Do exercise. I know men like walking. Rarely will you see women walking. Few. I'm not being discriminative, but you will see few of them walking for a very long distance. So they need to start running. They need to do exercise. It helps. Even if you can't run, just do some little exercise in your sitting room in the morning before you start your work. It will help a lot.
Now, Dr. There's this caretaker who is taking care of an autistic child, or maybe a grown-up.
Yeah.
How do they handle them? How can they handle them?
It's a very good question, and I know as we celebrate the autistic children, it's not an easy task, because I know there are families who are watching this and they have autistic children. I know many might have even given up, but you should know that one day your autistic child will become a valuable child. It's not the end of the road for any autistic child, because at times you might have even lived that good life that I'm talking about. You do exercise every day, you never take an alcohol. I know not many women take alcohol and smoke cigarette, as I've said, but unfortunately you gave birth to a child who is autistic. So it is a journey. The first thing, I know there is always stigma. You'll find this autistic child, they are rarely seen in the sitting room. They are usually hidden, because some people still fear that they don't want their friends to see that they have an autistic child. That is stigma. This child will not grow. let the child come and start knowing that this house can have visitors, can have new people, it's not the house of my mother and my father alone. But if you keep your child in the bedroom, this child will not grow. Let the child even crawl like other children do. You see what the normal children do?
Yes.
They crawl and pick the small things, put them in the mouth, throw them. They have food in their mouth. It falls down. They pick it. They eat. You know. So let this child start. Even if they have delayed milestones, let them just go through them. Even if they are 12 years
Yes.
and they are still crawling down, let them crawl. Number one. Number two, if you are leaving your child, because I know most people are working and they leave the children with the house girls.
Yes.
Or housemaids.
Yes.
Let this house girl come to the hospital. Unfortunately, most parents don't bring these house helps to the hospital. They just take the child to the hospital themselves. Then the children are not left with them. You understand? So the house help knows nothing on how to take care of this child. But if you could know that this child needs, this house help needs to know what to do, bring them to the hospital. The doctors will teach them.
The house helps as well.
The house helps as well. You and the house help. And even every person that is involved in this child's growth. If it's the grandparent, if it's who, let them come so that they can understand. So let everybody have their hands on the deck in terms of taking care of this child. But if you as the parent, as the mother alone, takes the child to the hospital, the other people will never know how to handle the child.
Yes.
Yeah. And they have to understand that the child is sick, but not very sick, because it's a chronic problem, it's a chronic disease. So it's not even a sickness, it's just something that is there. It's like a disability. Yeah.
Is there any hope that these autistic patients can get well?
It depends. You know, there are levels of, that's why we call it a spectra. There are levels of diseases and maybe stages. There are those who are just autistic and they have just one behavior failure. Let me say a behavior failure. Maybe their problem is just eye contact. But they can talk, they can read, they can learn. They are even in normal schools. And even they are passing exams, you see?
Yes.
But there are others who are very sick to an extent that they cannot grasp anything. They are a bit slow. And they have to be in special schools.
They have multiple characteristics.
So it is just the doctor to make a diagnosis, the pediatrician to make a diagnosis. Then they can now advise you on what steps to make.
Now, on your side now as the doctors,
yes,
how do you treat such patients?
Usually, we want to reduce harm. So we teach the parents on how to reduce harm. So like, this is not a child that you will take a knife and put it on the table and leave it there. The child might even commit suicide with a knife. You see?
Yes.
This is not a child who will leave drugs there, and because their cognitive function is not okay. You know that a knife is used. Most children know that a knife is used to maybe cut onions and tomatoes. But him or her, they understand that the knives, maybe they have seen it in a movie. The knives is used to chop off people's necks. So another time you'll find this child, they are trying to cut off their necks. So don't put things that can harm these children on the tables and everywhere. So harm reduction. Then just reduce things like stones in the compound, because they can even pick a stone and hit other children, because their reasoning capacity is a bit low. So that's one. Then also things like trees, you just make sure there's somebody who takes care, because they can climb trees and even fall back and cause fractures. Then in the hospital now we also talk about speech therapy. We try to treat their senses to come back to normal, because sometimes these senses are not very normal. So they come to the hospital, we do what we call speech therapy, plus many other therapies that the occupational therapist understands. We can expose them to internet. There are several other applications that are there that can be used to treat autism. There are learning aspects. We take them to special schools, but also we advise them, the parents, on what to do in terms of making their cognitive function come up. Then we have their own way of handling their stresses, If the child is stressed up, the mood is not okay, there's a way of handling it. So you can't handle a child which is autistic like a normal child. So you just have to make sure that you follow the right instructions from the doctor. Yeah.
All right. Now, Dr. there are cases where a parent is complaining that I've taken my autistic child to the hospital and they've given her or him drugs that after taking for some time, the child becomes unresponsive.
Yeah.
They don't respond to anything, and eventually they even pass away.
Yeah.
How can you? What can you say about that?
The first thing is diagnosis, because when you are diagnosing an autistic child, you need to know, because some of them can have psychiatric disorders, because they can behave like they are psychiatric. So people tend to think it is psychiatric. So I can blame a misdiagnosis. Number two, the parents needs to know that there is no better drug to take care of autism than the parents themselves and the doctors and the occupational therapists. So the strength, the cornerstone of healing of autism, or maybe improving the quality of life of an autistic child, is making sure physically, because what has failed is your behavior. You can't keep an eye contact, you can't relate well with people, you can't socialize with people. So what you need to do is, first of all, make sure you bring it, the behavior therapy. We call it behavior therapy. So if you do behavior therapy to this child, it will help. Although in some cases, the child might have other related conditions like bipolar and other things. They might become violent. If you force them to do things, parents, sometimes we are so impatient with a child who is a bit slow. You are going to church, the child has only put on a shirt, and they are just walking to the car without a trouser. You become so impatient, you become so annoyed, and you start beating up the child. You don't know they are autistic, or maybe you know, but today you are
not in the mood.
You are not in the mood. So this child will end up becoming violent, because there are things that they are learning from you. If you are violent, they are also violent. If you are good, they are good. They learn very slowly, but they learn from you. All the behaviors the children have, even if they are bad behaviors, they learn them from the parents. So whatever you do, it will be seen from your child. So you don't rely on drugs alone. But I know there are those drugs that we give these children to calm them down, and they can even make you drowsy and sleepy. So if you notice that, just tell us so that you can reduce the dosages.
All right.
Yeah.
Now, Dr. one last thing. Just maybe you can take one of the cameras and just talk to any parent who has an autistic child, or any person that is suffering maybe from autism. What can you tell them?
Yeah, I know we have come a long way as a country. We didn't have so many children who have autism, but nowadays we have children who have autism. So my request to our viewers is that you have to be on the high alert. When you give birth to a child, start looking at the milestones. The children must walk at a certain age. Maybe they need to walk at 1 year. They need to start talking. They need to start to giving you a word at 1 year. Then if they delay these milestones, make sure that you come to us. Number two, for those who are living with children who have autism, you have a lot of work to do, but you shouldn't give up, because your child needs to live their normal life forever. Even if they'll reach 100 years, they'll be in your hands for a few years, then you will transfer them to their own. But you need to make sure that they grow. One day or one time, you'll realize that this child will outgrow these childhood behaviors and they become adults, even if it will reach at 40 years or at 30 years. But at one point, they will outgrow. Although they should know that autism is a chronic disease, it cannot heal very well. So somebody should not cheat you that it will get healed. But at one point, the child will improve their behaviors and they will live a very noble life in their future. Yeah.
All right. Thank you so much, Dr. Silas, for sparing your time to be with us in this show today. And also thank you for the insightful discussion about autism. I hope you spare some time the other week as well, so we can discuss about something else.
Sure.
All right. That's the end of Health, Hygiene and Wellness. My name is Barasa Saenyi. Keep watching Imani Television, and and also keep track of health, hygiene, and wellness. Till next time, goodbye for now.